I would have experiential eating sessions with my client in the office, out of the office. I mean, since COVID, I've had to be pretty creative, like get your snack, let's have a snack together. And where it's not, just talking, where it's like, oh, I'm with someone that I feel safe with and that I'm eating and I'm being challenged. So I've had to take it up to a whole new level through Zoom. It's never too late to get help. It doesn't matter how old you are, how many years you've been engaged in your eating disorder.
It starts right here. Start right here. Hi, I'm Tom Rutledge, and welcome back to what is the name of our thing? Oh, start right here. I was trying to figure out where I was, and now I'm right here. Start right here.
Might have
our podcast.
You might have COVID. One of the signs of COVID is a memory loss. So we are already that there's a possible symptom.
Well, I have a different. I had my second. This is hard to say. I had my second shingles shot yesterday. And I for some reason it just kind of just wigged me out, just kind of knocked me for a loop a little bit, and I don't know why that is, but I have been practicing saying second shingles shot, and if there's anything wrong with me today, I'm blaming the shingles shot.
I'm impressed that you're doing this the day after your shingles vaccine, especially the second one, because that one's the worst from what I've heard.
Oh, I need you. This is so helpful, because I was going, I don't think I'm supposed to be having this. And then Alan, I thought, oh God, I have COVID. And then I thought, well, I don't think I do. But so this isn't, I'm not making this up.
No,
you look pretty functional to me.
Okay.
People not.
Well, wait until 20 minutes though. Well, you guys don't pass that judgment to.
Yeah. Well, I've been. Hey, listen. I've been faking functional for a long time, buddy.
I very relative term on this show. It's very relative. The bar that Tom and I set for functional is quite low.
Yeah.
Just us getting on the show is what we consider a victory every time.
We're showing up, and that's it. That's what most of it is showing up, right?
Showing up for the show.
I'm going to introduce our wonderful guest here in a second, but while we're checking in with our health, how are you in your COVID recovery doing?
I am gradually feeling better. I went a whole day on Friday and Saturday without a nap, and that's the first time I've done that in over 5 weeks. So
you had COVID.
I had COVID. Yes, I had COVID.
Yeah.
5 weeks ago, Saturday, I had COVID. So I'm post-symptomatic or post-infection 5 weeks, and it's lingering. There's no question about it. It's been very hard for me to exercise, very limited energy available, still getting headaches on a daily basis. My taste has not come back fully. So that cannoli that's sitting in my refrigerator.
So if I eat this Christmas cookie,
I will be jealous because you're tasting it.
Well, I'm glad you're on the up and up. No, I mean, I know.
I am too. I'm very grateful for this. The one thing I'm grateful for is that I had this catastrophic fear that if I got this thing, I'd end up in the hospital and on a ventilator. And I'm so grateful that hasn't happened. I've had very good medical care, and the docs are taking good care of me. And so
I know just going a day without having to have a nap is a big deal, because I know that's discouraged if for somebody with as much energy as you have for the, I'm not sure I ever had a day without a nap, but it's like, but you have energy. It's like, that's a weird thing for you to have to stop and rest and you got the those two little girls just challenging you constantly, and they probably are not making adjustments just because you have COVID.
No, they aren't. Okay. They want what they want.
Well, let me introduce my friend Robyn Goldberg. It's I don't know. I couldn't give you the history of my relationship with Robyn, other than I've known of her forever, and we've both been in the eating disorder treatment world, and I've never seen, read anything, heard anything from her that I didn't find just absolutely brilliant and helpful and useful. And she's here to talk to us today, but I want to say I've got a copy of her book. It's called The Eating Disorder Trap. And this is a compliment, Robyn. It's like, it's got coffee stains on it. It's like, I want you to know, it's like I've got, it's kind of been rode hard here, but this is
Coffee
100.
stains are like using a highlighter, so that's a good mark, you know.
That's what I've done. But this book is 150 pages, and I probably have. There probably are some books that I have read that have as much information, useful, practical, information in them as yours, but none more than yours. I mean, you have so much information in here, and it's not hard to read. I do not know how. I mean, I really admire how you, as a writer, because I always say that's all I ever meant to be. I'm an accidental therapist. As a writer, how you write to multiple populations, to professionals can pick this up and read it, and it's fine, works fine. Somebody who's interested in just learning something new for the first time about eating disorders could pick this up and learn stuff. And I mean, it really is like an encyclopedia, and it has everything from like just some of the smartest stuff into it to some of the most clever illustrations. Who did your illustrations?
A wonderful young man that I found. I had put an ad, and I probably had about 150 people respond. Yeah. And so Austin Baechle, who is amazing, I'm like his publicist, this guy who, his dream is to work for Disney or Nickelodeon. And he and his wife were working their way out to move to LA, but since COVID, they moved to.
Well, we'll definitely, say his name again? We'll give him a plug. Definitely. He's so good.
Austin Baechle. Yeah,
Austin Baechle. I love it. I love the picture where that is with the little chapter section called "Gotta Love Your Liver."
I'll give him a plug. I'll find his social. So he actually, every illustration, I had a topic of what I wanted to discuss and a vision of what I wanted the illustration to look like, because for discussing such a serious matter, I wanted to start out with something soft and understandable that anyone could understand. They don't have to be a clinician. And as you commented, Tommy, I appreciate the compliments, but I decided in my career, I've been in practice for 24 years. If I were ever to have written a book, I wanted to write something, A, that was inclusive to all, B, that you don't have to be a PhD to comprehend it. And finally, to be able to have something that isn't a quote unquote another book on eating disorders in the profession. And I think I accomplished that. It took me over 2 decades to think of what I wanted to do, but there it is. But Austin's Instagram is the letter A grumpy guy. And you could see all his illustrations. He's awesome.
Okay.
So yeah, he's my guy.
We'll include it with the show notes.
Okay, perfect.
I think my wife would think that that's my Instagram sometimes. A grumpy guy.
No, she thinks yours is the grumpy guy. It's like it's a little different. You're the one. It's like
I'm the one they call the.
Well, okay. Well, here so Robyn, I have my list here of introductory stuff. I mean, certified eating disorder registered dietitian specializing in medical conditions. It's just some of it. Medical conditions, disordered eating disorders. I want to definitely talk about what health at every size. I love the work that you do with that, and with anybody who is
the Hayes community is very big, and
it's so important after being in this eating disorder recovery world for a while. I was so happy to see that. But pre-pregnancy nutrition, people, Alan, she has a lot of experience working with people in recovery from addiction. They've quoted you in the New York Times, and Oxygen's Oprah's thing, right? So Oprah's been talking about you.
No, it was a different. No, it's not Oprah's, but
Okay.
Oprah adjacent. It's its own thing.
Oh, it is? Okay. Huffington Post, the television, you were a regular, like on the Insider?
I was.
Hmm. Was that fun? Do you like being on TV?
For the right piece. I mean, I think it's really about getting my message out. And that's always what my intent has been. So anything I've done, it's been that they have found me versus me pursuing them.
Yeah.
Well, let's start with you, Robyn.
Nice content.
I'd love to hear, what is the message that you want to get out? What's the focus of your work and the theme of it?
So I've been in private practice for 24 years in Beverly Hills, and I actually just moved my office since COVID. Built an office out of my garage, which I have not started my Zoom sessions in yet. But in any case, I started my career at Cedars-Sinai Medical Center. I was the cardiac dietitian in the Department of Gastroenterology. I was there for 5 years prior to starting my practice 24 years ago. And during that time, ran a number of body image and eating disorder groups at various sober livings around town. I'm married to someone that's coming up on 27 years of being sober. So that was sort of my introduction into the recovery community. And I had thought my message is, there are so many misconceptions centered around eating disorders, body image issues, who has them, who doesn't. My message has really wanted to inform not just the layman, but clinicians, because there's a lot of stigma amongst healthcare providers from the perspective of, you can't look at a person and determine if they are quote unquote healthy or not, or if they have an eating disorder. And I think there's so much re-education as well as the language that's incorporated into speaking with someone, since we're all born on a planet where there's messages through diet culture, and it's really understanding the origin of where that comes from, and also how to speak to someone in a manner that they aren't going to feel triggered. And that we can't always help, of course, but oftentimes individuals have trauma centered around food and body, because either they were fat shamed, or they're, like with healthcare providers, and I encounter this all the time, is that a physician wouldn't say the same thing to someone in a larger body as they would to someone in a smaller body, or vice versa. And it's really being open. It doesn't matter how seasoned you are as a clinician, to be able to learn how to communicate to a person that they will want to continue coming back, because in the healthcare field, that's oftentimes the place that an individual feels safe. But the other problem is they could feel misunderstood, because practices are very busy. And for an individual, like I was sharing with a gynecologist recently, that his patient has been purging during her entire pregnancy. And he said, "Oh, I had no idea." And I said, "Well, these are conversations that are not brought up. Oftentimes an individual will feel judged, or they won't know how to approach their doctor because they've picked up messages that could feel offensive." And I think it takes a special provider to be open in learning how to reframe their conversations to whomever they're sitting with. So that's to answer.
Well, look, it's a blind spot, isn't it? Is what you're really saying is it's the same thing we've seen in the field of alcoholism and drug addiction. There was an interesting study that was done with medical doctors, internists, and they looked at what were the variables that determined whether an internist would ask one of his patients about his drinking, and what kind of a conclusion would be drawn. So if the patient, first of all, if the physician was drinking a lot, he would never ask the question to anybody. If he did ask the question, he would determine if the person had a problem as if the person drank more than he did, which was a problem at times, right? Because if a guy's an alcoholic, guess what's going to happen? He's not going to diagnose and encourage anybody that's got an alcohol problem to go to treatment, because then he'd have to look at his own issue. And so there's a very interesting dynamic around this, isn't there? in terms of our own personal issues and our blind spots or prejudices and sometimes implicit biases.
Well, exactly. And I was going to say, so the survey on implicit bias through Harvard, I think, is something that every provider should do if they have addressed their own stuff. Because if they haven't addressed biases they have, if they feel, well, I wouldn't quote unquote see a person in a larger body. It's offensive to call someone fat or quote unquote obese or quote unquote morbidly obese. These are stigmatizing terms. So the bias they have to do that work, it's actually something I talk about in my book, that so many providers, A, haven't done the work, and B, they're not open to doing the work. I think in the eating disorder community, it's more likely that they're open to doing their work if they're treating this population. But the truth of the matter is, like, will a cardiologist or internist or gastroenterologist, maybe not. I mean, I cross paths with so many of them. That's a huge basis of my referrals. And when I speak to them, they'll just kind of chuckle like, oh yeah, my patients know I'm not, I'm joking, but it's like, they're not joking, because I have many that stop going to the doctor or they change doctors. I mean, there's so many studies based on like what you're describing with these hidden blind spots.
We could do it. I mean, we could do an entire, we're definitely going to have to ask you back because there's too many different things we can talk about here, but we could do an entire show on just that. It's like through the years of working with people with their eating disorders, it's like how much time I've spent coaching people about how to talk to their doctor, how to talk to their, even if the doctor gets it, this nurse doesn't. It's just, I mean, it's just scary how it's, because now I guess I'm showing that I'm a mean guy here, Alan, but when you said blind spot, I thought idiot spot. I mean, it's sort of like some of these people just are clueless and
misinformed.
Well, but right. But I sometimes have less tolerance because I can also say there's a lot of people I have had contact with and had clients who talked about who actually doctors who would say, I specialize in eating disorder, and they were the ones saying, well, you don't look like you have an eating disorder. It's like, I mean, it was ridiculous. It was like, and you have, the idea is you teaching people how to be good consumers and not just run away from all medical doctors because some of them are that way.
Right.
I mean, it's a challenge.
Right. So some of this is ignorance. Some of this is that, if the situation is going to create anxiety for the provider maybe will avoid it, just like they're avoiding addressing that issue in their life. As I mentioned before, very interesting in situation. I was doing some work with Beacon House up in Monterey, and we were talking about a case, and it was really interesting. This young boy who was like 13 years old was seeing this one therapist, and had been in, probably that was number 5 or 6 on the list, right? He was in foster homes and stuff like that. And the therapist says, well, look, I'd like to know, what you've done to address some of the abuse you've had. And the boy looked at the therapist and said, I haven't addressed it. The therapist says, really? But you've seen 5 therapists. He said, you're the first person who's asked me about it. None of them were comfortable enough. That's what the boy said. None of them were comfortable enough to ask me about what happened.
Or, Alan, what could happen is, and I actually, provide this in my book, is a number of screening questions that one could ask. And some of the questions an individual may not feel comfortable with, because then there's a series after the fact, and it could go down many ways. And if they don't have the skill set to know how to handle those responses, exactly.
That's the other part of it. That goes back to the ignorance and not knowing that, Tom so compassionately called the idiot factor.
I need to own this though. Now keep in mind, when I got sober, because let's face it, because my wife made me, I was the clinical director of an alcohol and drug treatment center at the time. So it's I do include myself in the band of idiots.
Hey, that's a new name for a group.
The Band of Idiots. Well, let's get started. We'll get Robyn's guitar
Husband. Well,
playing husband.
he's always
Plays.
wanted to start a band called Midlife Crisis.
Oh, I love it. I love it. That's a great name.
Alan and I can't be in it. We're way past.
And we lost the qualifications.
So is
Another
he.
qualification we lost. Oh my goodness. Do you know who Judy Hollis is, Robyn, by any chance? She
Judy
wrote Fat. Judy Hollis. Hollis.
Why do I know the name? I'm not sure.
She wrote "Fat is a Family Affair."
I know
and
that.
she-
Title. Yes.
She started many eating disorder units. She had one of the first at San Pedro Peninsula Hospital. Her first groups were Why Wait, WEIGHT.
Right.
And then after that, she started an eating disorder unit. I've known Judy for many years, and it was her calling. She was struggling with her own issues, and I worked with her over there for a long time. But it was some amazing work those 4 years I was at the eating disorders unit, and being a clinical director over there. It really was powerful work. I mean, incredible. It's a family illness. It really is.
Exactly. The family is a part of the treatment team as well. And
Has to be. And most people won't include the family.
yes.
They just focus on trying to control the patient, and it is that's part of the ignorance out there as well. So you work with a team then, is what you do when you're
I'm a
working with
part of
someone?
so many teams. Yes. I mean, it's ideal when you're able to pick the team for the client. So either they have an internist or a pediatrician, ideally an eating disorder trained therapist or another mental health provider. I mean, there's teams I'm on that I would say the lone wolf who has the medical background. I'm teaching the clinician, the therapist, and the physician what labs to have done, and then or a psychiatrist. So yes, I'm a part of many teams, and really in the eating disorder community, I mean, we know who those experts are. So I think when people will say, oh, I'm an eating disorder expert. Well, how are you on? Oh, I took one online course. Or back when there were these lunchtime talks at yes, but when the EDTC, the Eating Disorder Center of California, before Carolyn Costin sold, she would have these like lunchtime talks, and someone saying like, oh yeah, I've gone to one of Carolyn Costin's lunchtime sessions. Like that doesn't make you an expert. So
yeah, you can't do brain surgery that way, can you? It's
that would be scary.
You have I mean, team stuff is all through your book, but it's like I was when I was glancing through it just before we started, I was looking at the chapter 13 at the very end of your book. It's called Divide and Conquer, Meet Your Team. And I love what you have to say about how important it is that how the team has to work together, stay in their own lane, respect each other. There's so many different points you make in here in just a short amount of time. And that's been my experience as well. It's like, because one of the things I've known myself working with folks with eating issues is I definitely play a particular position, and without the other positions, it would be sort of like a running back going out on the playing field without a quarterback or somebody to hand them the football. It's like it really is a team effort. Yeah,
but sometimes a dietitian, like I will tell clients, I will not see you unless you are in therapy. I mean, that's necessary. And I have some clients that can't afford it. And there's several internists I work with where it's like the physician and myself, it's like we are the therapists, but that's not the ideal situation. Or I've had colleagues say to me, they don't want to see a dietitian or they can't afford a dietitian. So it's like the therapist will take on that role too. But I think the individual has to have that training, and I think it gets to a point where it's like you can't fake it anymore. There's no substitution for having those different ancillary professions.
Well, what I find is it's humility. It's like you have to own what you don't know. It's like, one of the things that I've told people forever of this stuff is like about needing to have a nutritionist on the team is like I'm really good at helping to coach and support you and help you motivate to do what you need to do, that you're in what the nutritionist is talking to you about. but it's like, you don't want nutritional information from me. It's like, I remember when I was early on, when I was doing workshops with Jenny Schaefer and Julie Merriman after Jenny's book came out. The two of them referred to me as the eating disorder expert who knows nothing about eating disorders, because and hopefully I know a little bit more now, but still, I mean, it's like, no, I need somebody who knows the science, and that's when I look at a nutritionist, one of the things I see is and this is all through your book too. I see just a very, very good scientist, because people, I tell these my clients, it's like, this person they're not going to be talking to you about the things you think they're going to be talking to you about. They're going to be, for one thing, they're going to talk to you about your brain, and how all this affects your brain. And you do need the right team, that's for sure.
Well,
and absolutely, you have to make do when you don't. I'm with you on that one as well.
Yes, and what I want to say from the science perspective, I mean, I have colleagues that are registered dietitians that never worked in a medical center. So I have so much appreciation and gratitude for the 5 years I worked in a medical center, because that, I think, has enhanced my skill set. But also, I mean, I had been trained by, one of the top adolescent eating disorder doctors in the country, Ed Tyson, who's in Austin. And so, I would go and
I know him.
be able to have the, supervision and be able to sit with him and the patients. And it's like, we don't get that in school. So I think it took me to a new level in my ability and what I was able to do with clients. And when I would see people in person, prior to the pandemic, I mean, I would take their vital signs. I would do everything but check their heart rate, because the individuals oftentimes seeing the registered dietitian more often than they are seeing their physician. So to be able to have that data, their blood pressure, their pulse, their capillary refill time, feeling their hands, feeling their shins. I mean, all these different screening questions that I've included in the book.
I told you how smart she is, Alan.
I was going to ask you one question, is that what role do you see that? Oh, thank you. Talk about nutrition. I just got my bowl of grains.
Say thank you. No, you did say thank you. Okay, I was going to correct you. You did.
So look, what I was going to ask is, what role do you see like the 12-step groups playing in your work with people?
I think the 12-step groups are great from a place of support, but I think so often, because there's so many different subsidiaries of 12-step, many are rule-based. And I think when there's rules like abstain from this, don't eat this, and then when we're told we can't have something, what happens? We think about even more so food-wise, and that could lead to a binge. So especially for the chronic dieter or the person who's going the OA route, and they have found, like, if you have relationships, I think that's a great tool to take advantage of. But I think from like the food recommendations, it's, their lived experience that they're giving these recommendations versus like what may work for one person may not work for someone else.
And there have been fractions of those groups, like Food Anonymous. I mean, they've taken the rigidity of OA and they've amplified it.
Yeah.
I mean, is it FA or something like that, or whatever those groups are? I mean, I've worked with some people, and the level of rigidity in their life is just incredible to me.
Yeah. And I think it's about having freedom and flexibility with food, as opposed to being afraid of any food or food group. And you might say, Robyn, I don't eat such and such because it makes me feel really sick. Well, you have to put your hand in that pot of boiling water enough to get burned and say, you know what, I've gotten sick enough. There's got to be a better and different way in how to approach this.
Yeah, there you
go.
Well, I believe in that so much, Robyn, is that really recovery is the discovery of new possibilities, and really being able to have different experiences with stuff that you would be off limits to you, that you thought, no, that's not a possibility for me, and to try it on and see if it fits and see if it can be of value. I mean, that attitude, that experimental attitude, seems so critical to recovery.
Being the scientist.
Yeah, there you go. That's right. Being your own scientist, isn't
Right.
it? That's right.
Yeah, I call it. We're gonna do it. We're gonna investigate this together. And what you guys are both talking about, the common ground there is something that Alan, you and I talk about all the time. And it's, nothing, original here, but it's about empowering the client. It's about letting the client, giving the client this amazing news that, by the way, oh, did you know that you get to choose what you do? Because so often what we're looking for when we're in pain and we're hurting and we're all of a sudden is somebody just to tell us what to do. And then too often we find professionals who are really, really ready to do that, or groups like you're talking about that just will say, okay, well, here's what you do. But that, it's about respect. It's about, we're going to figure this out together.
Like what you're saying, Thom, it's about learning how to check in with yourself, because our emotional status has such an impact on what we choose to eat, as well as the amount. And I think being able to even think about, like, I'll have clients, I'll say, well, what do you like to eat? No one's ever asked me that, because diets, what's called the weight normative approach will say it's harder the way I'm working with someone, because I'm wanting them to dig down deep and evaluate, what am I in the mood for? What do I like versus, well, I have to avoid this. I can't mix this with that. I can only eat between these hours. And eating is way less complex than how diet culture teaches us to be. So exactly with what your point is.
Yeah, well, I mean, and definitely we as human beings, we're very good at making things that can be simpler, highly complex, and so I think that's, but yeah, the other thing is we want to, I think probably one of the things that the three of us have in common is that we actually kind of enjoy thinking outside the box, and one of the things that we too often in this business just give lip service to is individualized care. It's like, ever since I used to work for marketing alcohol and drug treatment, when I worked for CompCare, Comprehensive Care Corporation, back in the 1900s, is that it was always about individualized care. Tell them about the individualized care. It's like, but I never saw it. I just told people about it when I was trying to sell the damn program, trying to get people in the beds. It's like, but what we know is what really works is to sit down with somebody and go like, this is about you. It's, I know a lot. We know a lot of shit that we've gotten from our experience from other people. But if we make the moment, Carl Jung talked about this. The moment you make an assumption, he said he tried to forget everything he knew before he walked in with a new patient, and that's what we can never do that entirely. But that's a pretty good idea.
Well, and like what you're saying too, Thom. I mean, I think oftentimes our clients want and appreciate that hands-on approach. So where it's like the way, Alan's with his lunch, like I would have experiential eating sessions with my client in the office, out of the office. I mean, since COVID, I've had to be pretty creative, like get your snack, let's have a snack together. And where it's not, just talking, where it's like, oh, I'm with someone that I feel safe with and that I'm eating and I'm being challenged. So I've had to take it up to a whole new level through Zoom over these last 10 months, exactly to your point, because it's nice to have that practical hands-on, but also the exposure therapy, because that is so necessary in being able to take something off a pedestal that's been seen as forbidden and taboo. And okay, the cupcake's really scary, but once you start eating the cupcake, it'll feel like your kale salad.
Oh, that sounds horrible. I don't want my cupcake to feel like that.
But where you've had,
sounds sad.
I want Robyn to take me through an experience with this bowl of wonderful food.
but like whatever it is you're eating, it's like you might say, I've had eggs thousands of times, but no, I can't have cupcakes. And well, how come? And being able to break down each layer of what the meaning of that cupcake is, and who said you couldn't have it, and what happens if you eat it, and what are your greatest fears when you have it? Oh, I'm going to be out of control, and I'm going to be fat, and I won't be able to stop, and then I'm going to want more sugar, and it becomes this like monster, and kind of like as you've said to me before, Thom, like all those shoulds, the should monster. Then their brain has been hijacked by all those shoulds.
Yeah.
Well,
And
talk
one of the
about
things
sugar for a minute, though. I want to hear about that. Does sugar?
I knew I was going to bring that up.
No, because that's such a good topic, right? Because the idea out there is, what was that book, Sugar Blues?
There's so many.
There's so many that we're addicted to sugar, that sugar is very dangerous. You got to watch it, get rid of it. Tell me talk about that with us.
So I'm going to tell you, because that's a whole other episode. But basically, when a client will say, oh, I'm addicted to sugar. And I'll say, well, does that mean if you had a jar of sugar that you wouldn't be able to stop? No. If I was eating a cookie or a cupcake or ice cream or chocolate, and oftentimes when we have a craving, it's due to what we're lacking in our diet. Maybe we don't have enough carbohydrates in our diet. Maybe there's not enough fat in our diet. And look, there's people that are always going to have that sweet tooth, and there's people that are always going to have that, salty, savory attraction. But those cravings intensify when we aren't getting enough of what we need, and when we've told ourselves we can't have this. So I would say a very high percentage of my clients will say, oh no, it's not the jar of sugar. Well, you can't be addicted to something you need to survive. And it's important to have some sort of fun food daily in our diet, or we'll feel like we're on a diet. So not every meal is going to be salmon and broccoli and brown rice. It's nice to be able to have some pecan pie. It's nice to be able to have a, peppermint bark. It's not like, okay, yeah, I'll have the apple instead. Maybe you want the apple, but especially holidays and different seasonal foods, sometimes those cravings increase, or it's something we look forward to. So I can tell you there's a lot of misinformation stating the whole piece about sugar addiction and eating sugar. It's like this drug or that drug, but it's very controversial in the eating disorder community.
Well, but the thing you're talking about, though, is the thing that I first ran into this with Nan Allison and Carol Beck here in Nashville years ago, who dealt with this in such a smarter way, and it was what I said before. It was about brain chemistry, and it was about what you just said is because I see people very often. It's almost like politics. Everybody just takes a position. It's like, are you for addiction to pie or not? It's like, it's like. It's more complicated. This is one of the things where sometimes we take simple things and make them too complicated. This is something that we need to understand is complicated. So the idea if I have a problem with that and I'm working with you, then not only am I going to be able to try some different things that you're going to guide me through, but you're also going to educate me as a client. It's like you're going to teach me that if you were doing this and that, because I remember just bootlegging enough stuff from nutritionists I've worked with for the longest time. I mean, first experience I ever had with that was I just mentioned to a nutritionist I was doing some co-therapy with at one point, that I get the slump and sleepy in the middle of the morning, and no matter what I ate. And she talked to me about, it's pretty common knowledge, I think, but it wasn't for me. She talked to me about what I ate, carbohydrates, all this stuff. She said, well, try this pork chop, put this, and get some protein earlier in the day. And sure enough, it's like all of a sudden my energy was different. It's something as simple as quit drinking so damn much coffee, Tom. And if you want to stay awake, drink water.
Well, I think it's really understanding the brain chemistry and the neurotransmitter pathways that are occurring as well. And the other part I want to say is when we're told that we can't eat something, like if someone were to say, Tom, you can never have a marshmallow again. I haven't thought about marshmallows in years, but when that's been presented, what happens? We think about it, we become more fixated on it, and we feel like compelled that I have to X, Y, Z. I got to grab that.
Well, what I tell people is here's the extent of my neurological knowledge. The brain doesn't encode a negative. So if I say, don't imagine Alan wearing a pink dress, it's like, well, there's no cognitive process that goes into that process. I mean, you just see it. Don't think of the color blue. Don't think of your left hand. And it's like, and it's amazing how much we do communicate that way. Don't do this. It's like,
well, not to get too far from the mental health aspect, but how much does marketing have to do with, how aggressively that sugar is being sold to Americans, let's just say? Is that a factor that's like worth discussing?
I mean, I think, Patrick, there's so much centered around diet culture. I mean, look, it's all about a business. It's, I mean, I can tell you, I was watching a commercial the other night, and I was a college tennis player, and I competed in triathlon for 6 years. And there's this new Kind energy bar. And my rep had sent me samples of it before, right when COVID hit. I was like, oh, this is great. This one has, more protein and more fiber. I really like it. And so the commercial was basically ripping on Cliff bars. They were comparing like, oh, this has, way less sugar. It has more protein. And I thought, well, when I did triathlons, Cliff bars were my bar. When I go on long rides, it's like each bar serves a purpose. I thought, so they're using the sugar card of what, you're speaking of. Yeah. So it's sort of like, people are going to think, because they're not informed, they may not know how to read labels or read them correctly. So it's like, oh, well, this is better. Okay, I'm not going to buy my Cliff bar. I thought, in my pantry, I've got some Cliff bars, and I've got some of these. I've got both because they serve different purposes for what I'm doing, but I have a different, knowledge set than the average person, and the average person would not know that. So that is a, true point, Patrick, that there's so much about diet culture and put out there, whether it's through the holidays or after the holidays, that it's really, I think, the capitalism, unfortunately, because each company has a shrewd marketing team that makes people feel guilt and shame when they are eating sugar, or they start to count their sugar and these types of things.
Yeah, very, very good point. And I just want to circle back to what you said, is that what I believe in is what you were talking about, Robyn, is this organismic wisdom. Is your body, it's like we don't listen to ourselves. We really don't. I love that saying by Gurdjieff. He says, we're all dreaming we're awake and we're asleep. and it's such a powerful thing, because we're so desensitized in terms of paying attention to ourselves. It goes back to some of what you were talking about with the shoulds. We get all these ideas about what we should be doing, how we should be feeling, how we should look, and all these other things. And we get totally disconnected from our experience. Completely disconnected.
Well, and not only that, I mean, when you think about even just like elementary days of our lives, when we're babies, when we're kids, when a baby is progressed to solids, they recommend, who's they? The pediatricians. It is recommended that a vegetable is introduced before a fruit. How come? Because sugar is something that, like, we all like sweetness. So I will never forget sitting with my client, and her daughter was maybe like 5 before the pandemic, and she had the snacks for the daughter, and she'd had in a bag some cookies, she had some pieces of broccoli, and she had some slices of apple. And oh, I'm hungry. And the mom took out, she said, well, what do you want? She showed all 3 bags, and the little girl picked the broccoli and the cookie, and she was sitting snacking on both. Like, okay, I'm done. And my client says, I would like to be that way, because to her, the broccoli and the cookie were the same thing, versus us being told, no, you can't eat that. You got to eat your meal before you could have the pork chop.
That's wonderful. Yeah. What a great example though, huh? The broccoli and the cookie at this. I love it. I mean,
and we all start out innocently like that until we become disconnected of listening to our body, or the messages we pick up in diet culture, or the medical community, or our families that influence the choices. But definitely.
Can you tell me the arc of treatment you see with someone that's really got such a body dysmorphia or a body image distortion, right? Where they can't see themselves. They see themselves as fat. And what do you see typically happens in the course of treatment with someone like that?
When I'm seeing someone that struggles with body dysmorphia, I think, ideally it would be wonderful if they are in therapy, but being able to talk about what they like about themselves, which is hard for many, many people, as opposed to what they dislike. Many people are able to comment what they dislike, but there's ebbs and flows, because with any treatment, Alan, it's, treatment's not linear. It's up and down. And some meals and some days are more successful than others. And there's times that they'll feel like, oh, I had a great therapy session with Alan or Thom. And it's like, oh gosh, I'm just hating this. And so it's common to have times that you
So
want
the
to quit and do it.
expectation is it's going to look like this treatment.
Yes.
It's not always going to be.
Never.
It's this positive progression to health.
Never. It's up and down. You'll take, I call
Yeah.
it the waltz. You're taking several steps forward and several steps backward.
I like the waltz part. Yeah. Tell me about your tennis. I'm a tennis player too.
Oh, cool. We'll have to hit. Oh, I played, I was on a tennis scholarship. I played 1 year at Sonoma State and 1 year at Cal State Northridge.
Oh,
So the
fantastic.
chemistry and biology courses took over my life. But yeah, tennis was actually.
Tom just sent me a text message that she's going to kick your ass.
Yeah, actually, so that was my ticket into many colleges that I did not have the grades for. And in fact, it's how I built my business, my tennis. I had a lot of regular games with physicians at Cedars-Sinai Medical Center, and I have restarted. Yeah, so that's my thing. Do you play regularly?
God, it's got to be 15 years ago. I went ahead and got certified as a pro.
Well, my husband's a coach for
Yes.
35 years. He used to travel with Pete Sampras and Lindsay Davenport when they were local juniors.
Oh, my fantastic. So I got into teaching tennis because my son was way into it. And so I was very interested in the psychology. So I come from the sports psychology side of it, right? So I do a lot of sports psychology and stuff.
Here, I'm going to show you. Do you know this book? I remember, hold on, we're going back in time.
I imagine it's going to be the Inner Game of Tennis, or
Yeah!
of
Right
course,
here,
the first. It's got to be, right? I mean,
my God, Alan. Wow, it's so vintage. It's yellow.
I know. And it was brilliant. It was back
And then
what's the next one? Alan Fox's book, or
yes,
look at
I
look
used
at
to
that.
go
Like
to
I'm a
his,
mind reader.
I used to go to his tennis camp at Pepperdine. What's my third one? Here, you'll like this.
Oh, Carla. Oh, yes, I've seen that. That's a good book too.
Oh
Yes.
my gosh, Alan, we're meant to be.
That is hilarious. So my son played Division I ball up at Cal Poly San Luis Obispo.
Okay, so I played Division II the first year and Division I the second. But
Second year. So
my
I worked
husband
with
was Mary Carrillo's Tubble's partner on the tour for me.
Oh, fantastic. I love Mary. She has developed to become such a great commentator.
Yes.
He was, huh? So he's a player too, huh?
Yeah,
So
he's from Queens, New York, and he grew up with Vitas and Mac, and we used to go to the Open.
Isn't that fantastic? Vitas Gariulitis, I loved his game. My God, that's wow, what a rich history you have in your family.
Yeah, so the whole tennis.
Do you hit with him still? Do you go out with?
I
your
don't
husband?
hit with him. I actually last weekend went and rented the ball machine. In fact, I remember, so unfortunately, I took quite some time off from playing tennis. It's coming on January 15th. It'll be 12 years. My father, Tom doesn't know this about me, unexpectedly passed away. He was 68. He passed away on center court at the country club I grew up playing with the tennis pro. So obviously I was so traumatized. My dad was my best friend. I got into my profession because of my dad. Thank you. And my family history of heart disease and hypercholesterolemia. And so it's now taken me like time to like get into it. And singles has always been my thing, not doubles. But now that I'm older and I'm always asked like, oh, play doubles. And so I have found it just great to be outside, and it took me a long time to be able to go outside and just have fun versus being so competitive, because I was competitive for so long that I never knew how to like go on a vacation. We couldn't go on a vacation unless there was tennis, since that was my thing. So
okay, all right, we're gonna go out and have fun, you and I.
Yes, I would love to hit.
Good. We're gonna go hit together. We'll do it sometime.
That would be amazing.
We'll get vaccinated or whatever has to happen, and then we'll do it.
That's good. Tom faded.
Tom is, he said he's having some difficulty, so I'll just go ahead and keep us going here. Well, look, it's so exciting to have you here. I mean, it's been a great time. We're going to have you back.
Thank you.
on the
It was such
show.
a pleasure to be here. I've really enjoyed
Yeah,
it.
it was fun. It's fun to find these connections in life, isn't it? I just love how that happens, and that we realize that we have that interest together.
Yes.
And
Thom did a mitzvah.
he did a mitzvah. He did. You're right. He did a
Right.
mitzvah.
Yes. My mother
Listen,
would say
as-
Thom,
as
my
we-
mother would say Thom is such a mensch.
It's so look, is there any one thing you want to say to wrap this show up from your side, Robyn? A message to somebody out there that's struggling with their eating, and what would you like to tell them, especially during this time of year?
What I would like to tell your listeners is that it's never too late to get help. It doesn't matter how old you are, how many years you've been engaged in your eating disorder. And also for those that are on social media, to be able to follow me, I put every day a message or two, something non-diet and body positive. My Instagram handle is Robyn with a Y, Goldberg RDN. And I can be contacted as well. I don't remember my Twitter. I'll have to that up, but in any case,
We'll get that. Patrick will put it in the
Okay.
show notes.
awesome. And my website is askaboutfood.com, and my book website is theeatingdisordertrap.com. And currently my podcast, every week I have someone on who is in the eating disorder arena or not. It's all kind of, tied back to the eating disorder, but my podcast is the Eating Disorder Trap podcast. It's on iTunes, Spotify, anywhere you would download a podcast. And I'm waiting to get the word any day. My book will be on Audibles, and I am the narrator for it, but has learned it's a
Oh, you did that. Good. They
I
wouldn't let
did.
me
I
do
had a number of requests for the book to be audio, and actually found it would just be ideal if I was the narrator versus someone that's not trained in it. It would have been, cool to have a professional person, but I found there's no one that's me. It's best to have me.
No, you are the only you, Robyn. Thank God you know that.
Yes, thank you. Yes.
It's good. Well, listen, it was a pleasure. We will have you back on the show. Thom, how do people learn about you and your work?
Can you see me?
Yes.
I've been on the sidelines for most of this.
Okay, well, we're wrapping up the show now, so we're going to have Robyn back.
We'll talk about
Okay.
Hayes and what you had said, Thom.
We talked a lot
Okay.
about you.
It's like-
Don't listen to the show. You'll get mad at Robyn and I.
I was just texting Patrick, telling him I couldn't tell him what was going on. Robyn, thank
So
you.
you want to tell everybody how to.
Go to my website and buy all my books, please. Yes.
Glad you joined us today. Like I said, we will have you back.
Thank you. I'd love to.
You can learn more about my work at www.abphd.com. Tune in to us. Join us on the Thursday night meeting. We have an emotional sobriety meeting on Thursday night. That's just a great meeting. Robyn, you're always welcome to come in and join that meeting whenever you want. It's really turned into a great, great support group for people during COVID. And we'll see everybody next time. Thank you again, Robyn.
Thank you.